I'm Forrest Gale, and my urologist of choice is Dr. Scott Simon, who practices here at Scripps in La Jolla. And I'm a BHP patient. I've been a BHP patient probably for 20 years. So I've had 3 different treatments. The last one, which was the Rezum treatment, is the treatment of choice. The first 2, one worked for about a year, the other worked marginally or not at all, and the Rezum treatment is now probably about 3 years in the past, and it's still working. And my reason for talking about this is simply to state that anybody who has this decision to make, who has BHP, and who is experiencing difficulty urinating and difficulty with the symptoms, this is a no-brainer. It's easy to do. The recovery is about 7 to 10 days. You have a catheter for a couple days. Take that out, very little or no bleeding, and then the results begin to accrue, and they're still operant in my case. My reason for doing this is just if anybody's on the fence, you should do this. And the results are overwhelmingly good for majority of patients, so I've read. The start and stop urination, where you urinate and you stop and you start and you stop, the long duration of the urinary process and having to stand there with a long period of time and you don't pee out in words of one syllable. The advantage is after you have the procedure, you can pee out. You get up in the middle of the night, which I do. I'm up once in the middle of the night and then once early in the morning, usually twice a night. You don't have to spend 5 minutes trying to pee. You pee quickly, and even now after a few years here, I may take a few seconds to start, but once I start, I pee out. So that's the advantage of it. It's just comfort and convenience, and as opposed to having something that's in the back of your mind, you're worrying about all the time, you're thinking about it because now you got to pee, and this isn't going to be just a walk in the park. So what you want is something that's a walk in the park, just like when you were 20 years old, and this at least gave me that. Oh, no big deal. The catheter is uncomfortable, but not much, not bad. You have an indwelling catheter for a week. You walk around with that. No big deal, And I'd say that the procedure itself was not uncomfortable at all. I wasn't uncomfortable with that procedure. I like coming to Scott Simon's office. It's comfortable, pleasant. The staff is great. Norma and the other gals are great. They're easy to get to. You call on the phone, you actually talk to somebody. You're not going to wait 10 minutes to talk to them, and then you make the appointments. The appointments are easy to get, and it's a very smooth and easy process and a very comfortable place to come. As a matter of fact, I can't think of another medical office more comfortable than this one to be in and to interact with the staff and, of course, with Scott. Dr. Simon.